Hello and welcome to another edition of Careers in Coffee here on Thursday late morning. Thank you all for being here. It is my privilege to welcome Project Horseshoe Farm here today. And one of the main things I get when I talk to students about Project Horseshoe Farms, one of the main questions is about the name. So I'm going to make sure we get that covered because it's a little counter to what the actual programming is. So I'm really excited to have Kira and Nasia here to talk to us about some opportunities with Project Horseshoe Farm. So I will mute myself and turn it over to the experts right now, and they have a little presentation for you guys.
Awesome. I'm just going to start screen sharing. I'm going to go on here. Awesome. Alrighty. As previously mentioned, we are Project Horseshoe Farm. This is what we like to call like a gap year opportunity, definitely for post-grads. And then in non-COVID years, we also have an internship program. So we'll briefly touch on that as well for you all. So an outline of what we're going to be talking about today, we're going to talk about our mission statement a little, the different sites that we have, sort of the 4 fellowship tenants, so kind of the things that we're focusing on throughout our fellowship program, and then also specific details for both the fellowship and the internship, and then of course COVID-19 updates and changes that we have made this year and will probably be implemented for a good bit in the future as well. A little bit of an overview of our mission. So Project Horseshoe Farm is, first of all, a 501c3 community health nonprofit organization. Our mission is a 3-part mission. It has to do with building on the existing strength of our community, improving the health and quality of life of our vulnerable neighbors, and preparing citizen service leaders for tomorrow's communities, which has to do with the fellowship program that we have. We mainly just work with vulnerable members of the Black Belt region here and work with the elderly population, mentally ill, and youth through our tutoring programs. And community is mainly like the central theme, the important part of creating change in the area. Awesome. So our first site that we're going to talk about is the site that Nasia and I both are at, so we can definitely personally answer any questions about this site. This is the first site. It's in Greensboro, Alabama. So as Nasia mentioned, we're in the Black Belt region of Alabama, if you're not familiar with that. It's a rural town that is about 45 minutes from Tuscaloosa, so close to University of Alabama and some of the major cities in Alabama. And to give you a little insight into our name, as you mentioned, we are Project Horseshoe Farm, but surprisingly, we don't live on a farm or work with horses. So in Greensboro, one of the housing sites, which we'll talk a little bit about, happens to be on a road called Horseshoe Bend. So that was the inspiration for the name. But I will say, because many of the community members are very nice and we live in a rural area, you could have the opportunity to work on a farm and see some horses if you'd like. So that is totally up to you. But yeah, so Greensboro is, here we have 10 community health fellows and 4 fellows on the hospital track. So they work directly in Hale County Hospital, gives you a little bit of a different perspective. And like you said, this is the earliest site that was the first developed, and we a little bit different from the other sites because we have sort of the headquarters of Project Horseshoe Farm. So we have Dr. Dorsey's clinic here, and he's the psychiatrist that's our director and founder. And then in addition, we have a lot of the programming that we do, we kind of run. So we run our own housing programs, where a lot of the other sites are kind of partnering with existing organizations. So it's a little bit different, and we can talk about that in the future too. Yeah, so our next site that Kira alluded to is Marion, which is also located in Alabama. It is about 30 minutes from both Greensboro and Selma. It is the seat of Perry County and has 2 small colleges, Judson and MMI. Marion is the seat of Perry County, and it has a number of nonprofit organizations as well as churches and other local NGOs that actively work with Project Horseshoe Farm in Marion to revitalize the downtown. Marion started about 4 years ago, so it's sort of a different level in the development of an NGO. So It's a really awesome site that is, working awesome. And then our last site, this one is very new. This is the first year that's been in existence. This is a little bit different from the rural Alabama sites. So this is Pomona, California, which is definitely more focusing on urban healthcare. The only stipulation for this site is that it's strongly suggested that you can speak Spanish or proficient in Spanish, since that's going to help you with the population you'll be serving there. And then, like I said, this is definitely a different perspective than you're going to get at the Alabama sites. So if you are interested, we can definitely give you direct contact information to fellows that are there. We can tell you about their experience. And then, since this is also a pretty new site, a lot of the work they do, as Anasi mentioned with Marion, is sort of getting to work on developing the nonprofit from the ground up. So it's like the first year in existence, they get to create new programming, partner with existing organizations, and really work to make a name for themselves in the community. So that's pretty cool and pretty unique.
Okay, so a little bit about the fellowship program. It is a gap year fellowship, usually between undergrad and some kind of graduate school. It's a 13-month fellowship. Housing is provided, and with a monthly educational stipend. So the approximate value of living and utilities would be about $7,000 to $12,000, which is all covered by Project Horseshoe Farm. And there's a small relocation grant from 100 to 300 based on how long fellows travel to get here, or the other sites. And then for Pomona, to sort of accommodate for the increased cost of living, they receive a monthly stipend of about 1,000, whereas here in Alabama we receive about 700. And it also includes like how much we would spend for gas and all of that taken into account. Yeah, so if there's any more questions about it, we'd be welcome to answer.
Yeah, and that's really nice, because then it takes off the stress of having to worry about like your gas and different car payments that you're doing and food and things. So it definitely takes the stress off and allows us to be able to do the work that we're doing here. So it's really helpful. And next, we're going to talk about our community involvement. So this does look a little bit different with COVID, which we'll touch on a little. So we do have community engagement projects. So what's different now with COVID is these all need to be outdoor projects. So we're partnering with people in the community. There's a variety of tasks. So Anasi and I both personally work with a local contractor in town. So we've been learning about different house maintenance and using power tools and whatnot, which is very interesting. So this is nice because it gives you a different perspective on your community that's very different from the work that we're doing on a day-to-day basis. So other people, I know some people in town work with, we partner with Auburn Rural Studios in Greensboro. So they also have been working on building some projects here around town, building a courtyard. And there actually is an option for a local farm. So Project Horseshoe Farm. And then in addition, people work with local lawyers. So there's definitely some options, and this is nice because we're able to plug into our community in a different way than we usually do. There's also Adopt a Fellow program. So obviously this looks a little different because usually the community really wants to get to know you. So a lot of times in the past, they would invite fellows over, have them for dinner or activities, but now we're still able to do those things, but they just have to be in an outdoor setting. Yeah, so it does look a little bit different. Same with community events. So we still have churches and other community members that invite us over, but they are, at least in Greensboro, and I'm sure the other sites have been really accommodating, setting up tables and things outside, which has been really helpful.
Probably easier for y'all to do the outside type settings than us right now. So the positive, maybe not right now, but
yeah. We will say that Alabama weather is very mild compared to Michigan. So, and then also, as we touched on, the housing is located in the community at all of our sites. So that's really helpful because you're living, and we want this to be like an immersive experience. You're actually living in the same community with the people that you work with every day. So that's really awesome. So in Greensboro, we have a couple different housing locations, but they're still all located pretty much within the community, and same with the other sites. So that's also really helpful.
And a part of the fellowship is group discussions. We have Monday group discussions every week. And these are here listed: citizenship, the biopsychosocial approach to medicine, leadership and management, the healthcare system, medicine and idealism are all sort of modules that we go through and discuss weekly on our Monday night discussions with our site director, which is also our founder, Dr. Dorsey. It's very useful, and I found it very helpful to like sort of give context to some of the work that we do with the community and with our housing program, and it's been really helpful to give a better insight into what we do. So that's been really helpful to us. Yeah.
Next is our Health Partners program. So this is something that happens at every site, and a lot of us, I feel like, find that this is part of our favorite thing about the fellowship. And even if you do the internship, you still get a glimpse into this. So this is really awesome. This is a unique opportunity for you to be partnering with people directly in the community, and we call them health partners. So here in Greensboro, we have about 7 to 8 health partners each, and it just varies depending on the site. But it's really awesome because you actually work with your health partner to sort of navigate the healthcare system. You can provide them transportation. A lot of them, they can just be social health partners. So you're just making sure that you're calling them or meeting with them and talking. Also, sometimes we also are dealing with finances. And then the big thing is that you're just working with them to create health goals. So you're really working as a team and a partnership. A big difference now with COVID is that we still have to meet them outside. And with transportation, we're provided N95 masks with the windows down and things, because there is really no public transportation in a lot of rural areas. So that's a big barrier that we still want to help alleviate there. And then another thing that I really like about this, and I know a lot of the other fellows do, is that we really get to be advocates for our health partners. So since we oftentimes accompany them to doctor's appointments and if they're Dr. Dorsey appointments, a lot of times we can go with them, make sure that they have their med sheet. That makes things go a lot smoother with the healthcare professional, your primary care provider, all those things. And we can also talk about the work that we've been doing with them. So if they've been walking once a week, or they've decided that they're going to smoke one less cigarette each day or each week or something, that's really cool to be able to showcase that to their own primary care physician. And then in addition to that, we can just make sure that they have an understanding of what's going on during the appointment, and also make sure that the healthcare professional does. So that's something that I really like about this. And like you said, you wear many hats in the Health Partners program. So like we said, a lot of people are working with people through insurance and things. Like we said, we do finances, and it's really just a range of things we get to do, but it's nice because we get to build those relationships with people directly in the community, and get to help them, and also get to spend time with them. So it's really nice.
So the next one is community center support. So mostly, I guess now because of COVID, how we approach the community center program at Project Horseshoe Farm is slightly different. We were working on an outdoor community center program setting, but with our vulnerable neighbors being more risk, more at higher risk for COVID. We are sort of still waiting a little bit to start up, but normally we have programming for people in the housing program that we have here in Greensboro, and they all come down here. We have Project Horseshoe Farm in Greensboro has our own community center program, but in other sites like Pomona and Marion, they work with and sort of build upon the existing community center programs in the community. So they provide programming, and we come up with sort of a schedule for people, like activities from drawing to exercise, and it's just really a fun way to get to know people in the community. And also usually some of them are health partners, and it's usually been one of the favorites as well.
Awesome. So next we'll talk about our housing program. This is going to look a little bit different at the different sites. So as I mentioned in the beginning, Greensboro has 2 housing programs that we support here, that we actually take a part in leading, whereas with the other sites, a lot of the housing program support that they do is partnering with existing programs. Yeah. So partnering with nursing homes or other housing programs in the areas that they're in. But since we are pretty established here in Greensboro, we have 2 housing programs for women suffering from mental illness. So this is something really awesome, and I think that a lot of us enjoy this. So very similar, we have health partners within the housing program and very similar roles. So we're still working with them to create health goals. We want to still encourage healthy living. So meal planning with them, trying to incorporate a vegetable at each dinner, encouraging them to do chores and make a chore chart. Also just helping again with socialization. So a lot of times with our ladies, we'll do like holiday parties and things to make sure that we're celebrating their birthdays and fun events like that. Going on walks with them. So these are all things that we also do with our health partners, but it's nice in the housing program because we get to see the ladies pretty regularly. And they always have just a fun dynamic there. So that's really awesome. And it is nice because even throughout our time here this year, we've seen different ladies come and go. So it's nice because we're able to still meet people and support them. And yeah, it's nice. It's a nice option to have in our community. And like we said, we get referrals and things. So this is something that a lot of us really do enjoy doing here.
All right, so the next tenet we focus on is education, since youth are an important part of the community. And so our educational program had started way back in 2007 when Project Horseshoe Farm started, and we work in close partnership with local schools, offering tutoring and mentorship to students from 3 to 5 grades, 3 to 5. This is sort of like the format for how it was pre-COVID, where there would be 2 tutors per classroom, power hour, which we call where it happens 3 times a week. We basically meet students at the school and sort of just add upon and try to give them extra support in terms of where they are academically. And it just helps to improve student to teacher ratios and gives more individualized attention to students who need it. And yeah, so these programs are just designed to help our students, their academic skills, life skills, and character traits to improve, employability and higher education, and, citizenship, and all of these important sort of concepts. And now, due to COVID, we've sort of made the program so that we go out into the community and provide tutoring to youth in the community where they are at their homes. But we do plan to go back to this once things are safer.
Awesome. So next, just talking a little bit about nonprofit management. This is our last tenet, and this is really cool because I think this is a valuable experience that is awesome to get in your gap year, especially if you're trying to decide what you want to do. Because I mean, there's a lot of us that are going to medical school and grad school, but some people go directly into the workforce. Some people want to go into education. Like this, I think a thing to notice is that you're not limited by your interests in this program. So there's no major requirement. Like you could have studied whatever you wanted in college, as long as you have sort of a passion for public health and you're willing to learn about it and be in this immersive experience, engaging yourself in a new community. So I think this could benefit anyone. And if it seems like it's something that interests you, there's a lot of different things that you can choose to focus on. So I think that's important to know. So one thing is nonprofit management. So at every site, we all have pretty specific roles. So we're separated into operational groups, which means we're partnered with another fellow. And then we focus on, we're all just assigned tasks. So some people, all of us have something that's management and some administrative tasks within the organization. Finances, so there's a group that's assigned to finances, but we still all get a turn in focusing, doing a monthly variance report, working on the yearly budget whenever we transition to this fiscal year. So those are all things that I think are really important to learn, and this is as good a time as any. Also fundraising and development, public relations. We have people that focus on recruitment and things and are in charge of that. And also like we'll be in charge of the new incoming fellow class and being their point of communication. Tracking program efficiency. So these are all different things that we're able to focus on. So, but it really does show you that there's a lot that goes into running an organization and a nonprofit. And so it's nice to see that we all get to work together, but have our specific tasks. So for instance, like my operational group, we are in charge of our Meals Out program, which is something that we have started with COVID, which we think is nice because it's a way that we can do contactless delivery, but still, this was in the past with the community center programs, we would focus on nutrition and things, so we're still able to do that in a COVID-friendly way. So we've created this Meals Out program here in this fellowship, which I think all the sites do, which is really nice. So we're in charge of that, and we're in charge of things like vehicle maintenance and our main admin space. So it's interesting to see all the different things that you're learning in this process, which I think is really helpful.
Definitely. All right, so COVID updates and changes. As we sort of mentioned, throughout, due to COVID and the subsequent pandemic, we've had to sort of change up our programs a little bit to sort of better, reflect the precautions that we need to take. So protocols have been established for all the programs where we sort of try to increase mask usage, make programs more outdoors versus indoors, decrease the number of people that are, even if it's outdoors, outside together at a certain time, reducing length of time of contact, and all of these things. But it's also been really nice since, the Greensboro site, for instance, has sort of existed in the community for so long. And our mission mostly is sort of trying to cater to vulnerable people in the community. So it's always possible to come up with creative ways to try to meet that mission. So it's been nice to be a part of that process of coming up with, a youth program format and trying to reach out to people and sort of do the on the ground work that usually doesn't happen when it's a more developed NGO. So that's been really nice in that sense. And like due to COVID, a lot of our neighbors have been more isolated. So, kind of coming up with creative ways to try to visit them or make cards and try to find creative ways to connect with the community has been very valuable. And people have really appreciated that, especially in these times. And so we've also like creatively tried to, try to continue our youth program, as we discussed earlier, in our health partners program, nutrition and housing, like Kira just mentioned, and our housing program, and the ladies that we work with, trying to have them, have activities that they can be excited about while still being safe and being involved with the community outdoors, have all been ways that we've tried to stay connected even in COVID times.
Awesome. So as we mentioned, it's kind of a fast turnaround when we're talking to you today, but our application deadline is February 21st. So in just a couple of days, we have our apply email here. So if you have any questions, and we would definitely be willing to answer any questions for y'all, and also can give you fellows at specific sites if you had site specific questions. Yeah, that's all we got for you. I can stop sharing. Awesome.
Yeah, I just have a few follow-ups. You checked off my list of questions pretty much one by one, so that was great. One question our students usually have is, what does the application process look like? So say they apply by Sunday, what does the process look like going from there?
Yeah, so that's a great question. So you can go to our website. You can just look up Project Horseshoe Farm, and the application is on there. So basically, you'll end up filling out a Google form, and the first application is basically, we just really want to get to know you. So you're going to fill out, your general information, and then there's like a personal statement, and then there's also some essay options. So you basically get to choose really right in your interest. So it's nice because we really just want to get to know what you like, what you want to do, and what you want out of this gap year experience, pretty much.
There's a question of like previous experiences, leadership experiences that people might have had, and personal statement, and the essay option that Kira mentioned. And then the next step would be an interview, and then you might get an email back in a couple of weeks or so regarding next steps. And then after that, we would update as we go along.
And you don't have to have like a letter of rec or anything. Yeah. So I know, like, since it's a fast turnaround, there's an option for references.
Yeah.
But you don't need to like ask people in advance for a letter of rec. So that's something good to know. And then yes, like Inacia said, there's first round interviews, which will actually be with fellows. So some of us will get to meet some of you, hopefully. And then the next round of interviews would be with a site director. So those are like the realms of the interview process.
Awesome. The only other question I had was basically, you said it was a 13-month fellowship. So I was just wondering the time frame. Say a student was lucky enough to get selected, when would they start and how would that wrap up? Just what does the timing look like there?
Yeah.
That's also a great question. So the fellowship starts around June 14th, right?
I think so.
Yeah.
This year is going to be a little different with
Yeah.
COVID. I think they're going to try and bring in the new fellows at the very end of June, but usually it would
Usually
be in
it
the
would
middle.
be like a month overlap so that the new fellows coming in would have about a month to work with us, and sort of we would, you know, have a soft handoff with like health partners and youth. And so they would sort of have existing fellows to guide them through the process of sort of understanding how the program works, working with us for a month. But now because of COVID, we're sort of reducing the overlap to just 2 weeks. But then we still have that 2 weeks to get to know the community and get to know the new fellows. And then they would just continue on until the next, so like 13 months starting from June.
Yep. So, and then, yeah, so the year ends technically like the second week of July would be like your contracted date. So, yeah,
Great.
that's nice.
Yeah, that was the main questions that I had. Thank you so much for taking the time to share this with us today. And like they said, if you have any interest or questions, you can feel free to reach out through the Project Horseshoe Farm website. So thank you much for your time. Good luck in the weather, and we really appreciate you being here.
Awesome. Thank you so much. Have a
Yeah.
good one.
Have a good one.